All right, let's talk about the CT scan of the head in particular. We don't call it CT scan of the brain, we call it CT scan of the head. MRI is of the brain, but the CT scan is of the head. One minor difference important to remember. What kind of questions come up in CT scan in the exam, or what kind of discussions come up in the review? What kind of information you think will be useful for students to know about the CT scan of the head?
Yes, I think this is a great topic. A few things I was thinking of are one, sort of what are the indications for ordering a CT with and without contrast. Two, maybe just identifying some common structures. And then three, maybe in particular, looking at some images related to stroke pathology.
All right, I think those sounds great. Hold them in your mind because I might forget, but let me take a step back and actually just talk about CT scan. What is a CT scan? So I'm gonna again, use Dr. Google and share some of the pictures. None of them is my copyright or information. I just Googled it. They popped up, and you can do that too and find it. So CT scan, people don't realize, is basically just X-rays. And it is really shocking if you don't think about it. But if you really think, what does CT scan stands for? CT scan stands for computed tomography. And computed tomography is a branch of science which is the study of placements of different things and how they relate to each other. So computed tomography or CT scan is a mathematical technique where a computer is able to take multiple X-rays from different angles of the same part or slice of the brain or skull or head and overlap it and create a map through that multiple X-rays. So if I share my screen here and show you on Dr. Google, this literally is what a CT scan starts as. And these are the X-rays. And these lines are where the computer will be calculating multiple X-rays. So computer will take multiple X-rays from different angles on the same slice or line, and then compute it together to create a computed tomography. And that is what a CT scan is. It's just a series of X-rays. It's a lot of X-rays. So a CT scanner is basically has a X-ray source and a receiver, and on the opposite end of each other. And they're mounted on a ring that can rotate. And when the ring rotates, it takes pictures every few rotations. So in one circle, it can take 16 X-rays, which is minimum, which is called 16, I think sometimes called 16-foot slice CT, or it can take all the way up to 256 X-rays in one rotation. And it can then use, say, a computer program to overlap them and compute, and it matching point to point, okay, this point, this X-ray, this point is this point, this point is this point, this point, this point, and creating a map of the brain, which is called computed tomography. Now, the limitation, of course, is that it can only take slices in one direction, and you're already using that information to compute. Now, any other change after that is further and further and further computation. So that's where you can have a vertical CT, a coronal CT, but is a further computation of the axial CT. Now you can have 3D CT scans, which is again further computation of all the CT scan that you've created. So it's math over math over math, and the errors goes up and it becomes more difficult. So let's look at a CT scan image and see what exactly is the information that we are getting. So if you look at it, there is the darkest point on CT scan, which is black, and there is a brightest point on the CT scan, which is white. And CT scan is a range of whiteness between absolute black and absolute white. And the range is divided into these minimal units, which are called Houndsfield units, HU or Houndsfield. Houndsfield was the guy who invented CT scan. So a Houndsfield unit. So the black is minus 100 Houndsfield unit. That's the lower limit. And the white is plus 1000 Houndsfield unit, which is the white. And everything is in between. So this gray matter might be 80 Houndsfield unit, plus 80 or 120 Houndsfield unit. And the CSF might be plus 30 or 25 or 20 Houndsfield unit. And if you have a more dense cartilage in there, that might be 300 Houndsfield unit or 250 or 200. And actually in softwares, you can move your mouse on pixel to pixel, and it can tell you the exact amount of Houndsfield unit that pixel is. Now, there is another concept which is called windowing. So once you have a CT scan, you can ask the computer to make it more bright or less bright. Now you are now artificially filtering the Houndsfield unit. So, but the natural calculation is Houndsfield unit, but now you can make it more bright and less bright. And sometimes we call them window. I don't know why we call them window. So there is something called bone window, where we say make everything move towards so create a filter for the lower Houndsfield unit. Anything below 0, cut it off. Now what it will do is that anything which is only slightly positive will become much more darker or absent. So it will leave out. So right now, if you look at this bone here, it is very dense and has no information, no detail. It's completely black, completely white. Now, if you need to see this information, you need, right now the image is going from -100 to 1000 Houndsfield unit. You say, I want to filter it, so it only goes from +100 to 1000 Houndsfield unit. So there is more detailed definition available here, but then all of this information will be lost. And that is called windowing. So you have a bone window, you have a soft tissue window, you have a CSF window, you have an air window. So it depends, it's basically various ways to filter to try to see image differently. And then you also have like an interactive windowing where you can grab the screen and just change the windowing until you feel you are able to see it, more or less grainy as you want to see it. And all of that is artificial processing by creating filters of this natural Houndsfield unit. So what is the absolute -100 Houndsfield unit? Is there? So air carries -100 absolute negative Houndsfield unit. And what has a +1000 is the outer layer of the calcified bone. So not whole bone, but the most densest part of the bone has +1000 or close to 1000 Houndsfield unit. And everything is in between, soft tissue and so on and so forth. And so you will see anything which is calcified as more Houndsfield unit, more white. Anything with less tissue like water, CSF, closer to air will be more dark, closer to the -100 Houndsfield unit. And that's what creates the contrast in the CT scan. And in a CT scan, if you look at the gray matter, which is the outer margin, is usually more white, more dense, more white, while the white matter is more gray because it's less dense. So the less dense it is, the more dark it is. So it's gray. So the white matter is gray in a CT scan, and gray matter is white because more dense. Anything more dense will become more whiter and will visible that way. You can see the air pockets here. You can see the CSF pockets in here. You can see the sulci, a sulcus, which has water coming in, will look like this. And then of course we have a gyrus, and then the outer rim of the gyrus will be whiter. And then the center of the gyrus will have the subgyral white matter, which will look like gray going in 3. What do some common pathologies look like? For example, if you have air in the skull, it will look like black. If you have blood in the skull, blood has different phases. So initially, the blood is very dense when the blood happens. And the reason is that the blood has a lot of iron. It's very dense, it looks bright, white. But if it stays there for a while, which could be 2-3 days, then that iron is taken up by macrophages and removed. And blood cells are killed, is liquefied, it becomes more of a liquidy clot, and then it becomes gray. So it goes from hyperdense to dense to isodense. Isodense means that it looks almost the same gray as the brain. And then hypodense, that if further eating of that clot and it becomes more water than tissue and it becomes dark. So those are the stages or evolution of a clot. Initial fresh clot in the brain looks hyperdense, almost close to bone because there's a lot of iron in the fresh blood. Then it becomes dense. Then it becomes isodense, meaning that it looks like gray matter. That's typically 2 to 4 days, 5 days after the bleed. Then it becomes hypodense, which is usually 14 days or more after the bleed, usually 3-4 weeks or 6 weeks or so. So those are some of the examples for the CT scan tissue will look like. Let me show you now some pathology, and we can talk a little bit more about this ideas of CT scan. But while I'm waiting and sharing the screen, does anything come to your mind so far? Any question? Does this make sense?
Yeah, this is all new information to me, which is very helpful. I didn't realize that blood, changed colors in terms of its density. That makes sense in terms of the macrophages. And then also the Houndsfield units, as you mentioned. I knew bone was more dense and it appeared white, and air or fluid appeared darker, but I didn't know in terms of the numbers. So, and then I guess one more thing is, sorry about that. One last thing I was going to say is, you also mentioned you're able to change the filters, and I've seen that done, but I didn't realize exactly, what was the purpose of that or what that was doing. And you explained that great.
All right, let's do some mental exercises based on this information. What would a tumor look like on CT scan?
Tumor, I think, would probably be dense, right?
Right. So, right, the density or the whiteness of the tumor will depend on the compactness or amount of cellularity in the tumor. So, most tumor are dense, so they look slightly brighter than the tissue around it, so you can see them. But some tissues are isodense; they have the same granularity or cellularity as the tissue around it, and then rarely some tumors start liquefying in the center, start necrosing. And if there's no bleeding into that necrosis, they will look hyperdense centers. They will have like pockets inside. But if there's a bleeding into the tumor, then that will look like hyperdense acutely, and then go through the same clotting stages as we often do. So a lot of time, tumor is only slightly more dense than the gray matter. And if you're carefully looking at it, you can see it, but there is a way to increase the density of the tumor more than the tissue around it. And that is the contrast agent. So the contrast is made of radioactive iodine, and radioactive iodine is very dense. So when it accumulates, before the radioactivity is gone, it is very dense to X-ray. So when the X-ray passes through it, it becomes very bright. Now, initially, if the contrast is not leaking into the brain, then you just see the contrast in the blood vessels. So when you give a contrast injection, you do a scan, you just see it in the blood vessel. Now, if it's leaking because of a rupture of an aneurysm, you will see it leak into the spinal CSF or into in a place. Now, if you give it into a patient with stroke, the contrast will not go to the dead tissue, but it will go to the rest of the brain around it. So the rest of the brain will become slightly more dense, while the stroke will become less dense with contrast, but it's not that much of a difference. And that's why we don't do routine contrast studies. Opposite is true for tumors. Tumors are very vascular because they're fast growing tissue. So they grow their blood supply with them. Otherwise, they will start necrosing and dying. So when you give it in dye to a patient with a tumor in the brain, the normal brain will get some of that contrast as a blood flow, but the tumor will get 10 times more. And now the tumors light up. Now, in a contrasted CT scan, tumor will be very bright because a lot of more blood vascularity and engorgement, and that's why it will be much more visible. So the contrast has a huge value in a tumor-based study, a tumor study, but not much of a value in a stroke study. And in a normal brain, the contrast won't do much. It does have some value in blood vessels. So if you're trying to look at the blood vessels themselves, because the blood is flowing in the vessels and has the contrast in it, they will light up a lot. So let's look at some of these pathologies and see what they look like. So these are mostly pathologies related to stroke. So, this is a CT scan of a patient with stroke. As you can see that the stroke has just set in. So it's almost impossible or nearly impossible to say if and where the stroke is. The only difference you might notice if you pay close attention will be that there is some loss of gray and white matter distinction in this area, where it's kind of all becoming blurred. What is a white matter? What is a gray matter compared to back here, where this is the white matter and this is the gray matter, this is the white matter with opposite color, of course. But this is the same brain scan, this one here, A, with adjustment of the window, contrast adjustment. And you can see that they have removed the negative part of the Houndsfield unit, let's say below 0. And what it has done is that the brain has started to disappear. But now you can see more details in the skull. So you can start seeing these air pockets, which were not very visible before. But it has also highlighted the blood vessels. So you can see that there is a blood vessel on here and there's a blood vessel on this side. And what they're showing is that this blood vessel starts and goes laterally and abruptly stops. Now, the other blood vessel is only visible as a dot because this branching or spread of the blood vessel is at a different cut. So either the X-ray or CT scan was slightly tilted, which is common, even the best of adjustment, there is a few millimeter difference between right and left side, or the human anatomy is tilted. So human anatomy is not perfectly mirrored. So if you see a blood vessel on one side, you may not see the exact same slice, you may see it above or below the slice. But seeing the slice where there is a blood vessel, the problem here is the abrupt stopping of that blood vessel. And this abrupt stopping means that there is a block of blood flow. And that is why this windowing is useful. Then you can look at what is called a dense MCA sign, that the MCA, middle cerebral artery, is dense and has an abrupt stop, which means there's a clot in the middle cerebral artery, which means that there is a stroke that is forming or evolving over here that we still cannot see in the CAT scan. Here is another example of a CAT scan, which is essentially normal. Again, there is a start of a stroke, but again, this is too early and it's isodense and it's not able to tell very well. But then there is a modification of a CAT scan, which is called perfusion diffusion studies. So you do diffusion on a CAT scan, that how is water diffusing from one area to the other. And you can see that there is this blue gap where there is no diffusion happening, although there is blood flowing into there, which is the perfusion, but the water in these cells are not diffusing to each other. This is all mathematical calculation on X-rays. So this scan, which looked normal on a perfusion diffusion mismatch, has a stroke that is forming or evolving over here. So that's another technique you can use. Some other things, as I mentioned, you can have a bleed. An acute bleed looks very dense, almost like a bone. There is a bleed which is around the blood vessel. So this is subarachnoid hemorrhage. And the space around the blood vessels is lighting up with the blood that is seeped into the spinal fluid. And you can see the blood also in this fissure here, which is all subarachnoid hemorrhage. This looked like a star, and sometimes it's called death star. 50% of patients have subarachnoid hemorrhage that have a pictures like this will die. 50 to 80%. Best case, you can survive 50% of them. So subarachnoid hemorrhage. Another picture here worth looking at is the large stroke. So now the stroke is a day old, and you can see that the tissue is starting to die and is becoming more watery. And that's why it looks more gray as compared to the rest of the brain. But not only it is starting to die, it is also starting to swell and become bigger because there's more water. As more and more water come in, it's starting to make space. Normally what happens is that if you don't open up the skull like this one has opened, then it will push the midline, and the center line, the CT scan will start shifting to the other side. And this line is perfectly straight, which means that all the pressure has been removed by cutting the skull open in a large stroke. And this is what it looks like in terms of pathology. This is the midline, the skull is open, and this is the swelling or edema of the stroke. And this is the brain tissue actually popping out of the acute opening of the skull bone. They just opened up, and the brain was just waiting to pop out outside of the skull to try to have enough space because of the swelling inside. So those are some of the examples of what a stroke might look like on a CT scan with pathology.
That was very interesting. Thank you so much. I learned a lot. And as you mentioned, there's so many other pathologies that you can look at with CT. That was just one of them, looking at strokes. But yeah, thank you for all that information.
All right, thank you.